Nightmares can be triggered by many factors. Stress or anxiety. Sometimes the ordinary stresses of daily life, such as a problem at home or school, trigger nightmares. A major change, such as a move or the death of a loved one, can have the same effect. Causes. Nightmare disorder is referred to by doctors as a parasomnia, a type of sleep disorder. That involves undesirable experiences that occur while you're falling asleep, during sleep or when you're waking up. Nightmares usually occur during the stage of sleep known as rapid eye movement, REM. The exact cause of nightmares is not known. Nightmares can be triggered by many factors. 1. Stress or anxiety. Sometimes the ordinary stresses of daily life, such as a problem at home or school, trigger nightmares. A major change, such as a move or the death of a loved one, can have the same effect. Experiencing anxiety is associated with a greater risk of nightmares. 2. Trauma. Nightmares are common after an accident, injury, physical or sexual abuse, or other traumatic event. Nightmares are common in people who have post-traumatic stress disorder, PTSD. 3. Sleep deprivation. Changes in your schedule that cause irregular sleeping and waking times or that interrupt or reduce the amount of sleep can increase your risk of having nightmares. Insomnia is associated with an increased risk of nightmares. 4. Medications. Some drugs, including certain antidepressants, blood pressure medications, beta blockers, and drugs used to treat Parkinson's disease or to help stop smoking, can trigger nightmares. 5. Substance abuse. Alcohol and recreational drug use or withdrawal can trigger nightmares. Other disorders. Depression and other mental health disorders may be linked to nightmares. Nightmares can happen along with some medical conditions, such as heart disease or cancer. Having other sleep disorders that interfere with adequate sleep can be associated with having nightmares. Scary books and movies. For some people, reading scary books or watching frightening movies, especially before bed, can be associated with nightmares. #risk factors. Nightmares are more common when family members have a history of nightmares or other sleep parasomnias, such as talking during sleep. Nightmare disorder may cause excessive daytime sleepiness, which can lead to difficulties at school or work, or problems with everyday tasks, such as driving and concentrating, problems with mood, such as depression or anxiety from dreams that continue to bother you. Resistance to going to bed or to sleep for fear you'll have another bad dream, suicidal thoughts or suicide attempts. Treatments for nightmares in adults. Fortunately, there are steps you and your doctor can take to lessen the frequency of your nightmares and the effect they are having on your life. First, if your nightmares are the result of a particular medication, you may be able to change your dosage or prescription to eliminate this unwanted side effect. For people whose nightmares are caused by conditions such as sleep apnea or restless leg syndrome, treating the underlying disorder may help alleviate symptoms. There are a number of other steps you can take on your own that may help reduce your nightmare frequency. Keeping a regular wake-sleep schedule is important. So is engaging in regular exercise, which will help alleviate nightmare-causing anxiety and stress. You may find that yoga and meditation are also helpful. Remember to practice good sleep hygiene, which will help prevent the sleep deprivation that can bring on nightmares in adults. Make your bedroom a relaxing, tranquil place that is reserved for sleep and sex, so that you don't associate it with stressful activities. Also, be cautious about the use of alcohol, caffeine, and nicotine, which can remain in your system for more than 12 hours and often disrupt sleep patterns.